Isn't that amazing? I mean, how many times do you read that the drugs for this condition have zero effect and have never worked, and there's 60 of them that the FDA has approved? I mean, why is anybody even trying them if they don't even work? All right. This is the next study and theme, a medical journal online, a journal titled Planta Medica, Medical Plants. It's titled Butcher's Broom, a rich source of bioactive steroidal saponins. Steroid meaning reducing inflammation. You know what steroids do, right? Like prednisone reduces inflammation. This is the drug activity, how the medicine in the plant functions. From the pharmacological point of view, the most studied butcher's broom species is undoubtedly Ruscus aculeatus, a very ancient phlebotherapeutic agent. Phlebo, you ever heard of seeing a phlebotomist? Phlebo means blood person. Phlebo, blood therapeutic agent. Since the discovery of the vein constricting and vein tonifying properties of ruscogenin and neuroruscogenin inside a butcher's broom, and the particular butcher's broom called Ruscus aculeatus was extensively used, especially in Germany and France, for the treatment of chronic venous insufficiency, also for varicose veins, hemorrhoids, and orthostatic hypotension. You know, as I go through some of these research studies, sometimes I think, man, wouldn't it be better off to not be in America being treated by MDs? At least the MDs in other countries are open to all natural therapies that actually work. They've been using this stuff for decades. In fact, in 1972, inside a butcher's broom extract is something called sapogenins. Sapogenins, isolated from butcher's broom, also display anti-inflammatory activity in these rat studies they found. When they had rat paw edema from venous insufficiency, it's no different than a human's feet swelling. Their paws swell whenever they have venous insufficiency. Well, they saw that butcher's broom, as far as 50 years ago, was reversing this in mammals. This researcher named Rudofsky, we referenced him earlier, he reported a decrease of about 10% in vein capacity of blood 2 hours after swallowing butcher's broom in a supplement. Patients with chronic venous vein insufficiency treated with butcher's broom extract maintained constant vein tone, normal size of the vein, and had improved vein emptying, unlike those who didn't receive it. Other studies deal with the antimicrobial activity against 8 different bacteria and 5 different types of fungus strains. And butcher's broom has antioxidant activity also, as well as some compounds previously isolated from them: turmeric, caffeic acids, and rutin. By the way, rutin is also inside of our CardioFlow product. Butcher's broom has been investigated in doses of 125 milligrams for every 2.2 pounds, 250 milligrams per every 2.2 pounds, and 500 milligrams for every 2.2 pounds using 2 rat models of acute inflammation. Remember, if it happens in a rat, it's going to happen inside of you. The results of the experiment showed a dose-dependent anti-inflammatory effect. The more butcher's broom they gave them, the less inflammation they had. Isn't that amazing? This steroidal type compound in butcher's broom called ruscogenin has been found to exert significant, not a little bit, a lot of anti-inflammatory and anti-blood clotting activities. Anybody concerned about blood clotting? Anybody have an elevated D-dimer test come back? You better get on butcher's broom, and on our CardioFlow product, I'd recommend. Butcher's broom represents the best known and appreciated Ruscus species of plants. Listen to how long they've known about butcher's broom's effects on the blood. Since the Middle Ages, the young shoots of butcher's broom were used as medicinal agents for disorders involving the vein system, anticipating the proven success of its hydroalcoholic extract in Europe. That's just how they did it. They extracted the components out of the plant using alcohol. The scientific production focused mostly on Ruscus aculeatus, which is in our CardioFlow, butcher's broom. A biological evaluation of butcher broom's extracts were mainly focused on investigating and exploring deeper its use for venous diseases. Since the Middle Ages, that's what they've been focusing on this plant for, because it's so powerful. Due to its benefits demonstrated in several clinical studies, oral supplementation with butcher's broom is recommended. How about that? The anti-inflammatory effect could be superior to the reference drug called diclofenac. Can you believe that? According to the dose and the moment of determination. Okay, I have to focus on this one. Any of you out there on any NSAIDs? non-steroidal anti-inflammatory drugs, NSAIDs, Aleve, Advil, Tylenol, aspirin, you name it. Did you know, read this sentence again, the anti-inflammatory effect of butcher's broom could be superior to the reference drug called diclofenac. Well, what is diclofenac? It has these different brand names: Cambia, Zipsor, Zorvalex, Cataflam, Voltaren, Voltaren XR, and Dilaject. Those are drugs right now being prescribed all over America for people in pain. Diclofenac is a NSAID, a non-steroidal anti-inflammatory drug. It is used to treat mild to moderate pain or signs and symptoms of osteoarthritis or rheumatoid arthritis. Voltaren, another brand name of this drug, is also indicated for the treatment of ankylosing spondylitis, a very terrible spinal condition. The Cataflam brand of this medicine is also used to treat menstrual cramps. Also, diclofenac powder is used to treat migraine headache attacks. I want to remind you all, the research shows the anti-inflammatory effect of butcher's broom could be superior to the reference drug called diclofenac. I didn't make it up, but if your medical doctor has prescribed you any of these diclofenac drugs, here's their names again. Look at the screen. If you've been prescribed those for inflammation and pain, butcher's broom is better, superior to the pain relief. Isn't that amazing? Plants are better than drugs, baby. I love it. All right, now also in Theme Magazine, online medical journal, they studied the efficacy and safety of butcher's broom preparations in patients suffering from chronic venous insufficiency. I've shown you a few animal studies. It's time to show you some human studies. Extracts from butcher's broom rhizome have been widely used in the oral treatment of lower leg edema in patients with chronic venous insufficiency. In this study, 166 women suffering from chronic venous insufficiency, remember the pictures I showed you a little bit ago, 166 women with this issue. They took 148 of those 166 people. They had an average disease duration of the vein issue. Remember the pictures. They had to have those conditions an average of 14.6 years in the butcher's broom group. And in the placebo group, the average was 15 years they had the problem. They were eligible for this research study. The primary parameter was the area under the baseline of the leg volume changes over 12 weeks. They want to know what's the size, what's the weight of the amount of water and edema in the legs of these individuals, these women, after 12 weeks, 3 months only. Remember, they had these diseases for 14.6 years for the treatment group with butcher's broom, and those who didn't get it, 15 years on average. Let's read what they discovered after 12 weeks of giving them butcher's broom. 3 months only. Cardio flow. 3 months only. Here we go. There were significant differences between the treatment groups with butcher's broom and the placebo group. The change of leg volume after 8 and 12 weeks of treatment, for changes in the ankle and the leg circumference after 8 and 12 weeks of treatment, and for the changes in subjective symptoms, the patient telling you how they felt. Heavy, tired legs and sensation of tension were all reported to be better only in the butcher's broom group. For the changes in the symptoms, heavy lower legs, sensation of tension, think about your loved ones who have these conditions. For the changes in the symptoms in 12 weeks of heavier lower legs, sensation of tension, and tingling sensation, a significant positive effect with the changes in leg volume was shown. Overall assessment of the efficacy of butcher's broom was significantly better for butcher's broom. Considering the study duration of only 3 months, it is concluded that butcher's broom in the recommended daily dosage, according to the German monograph, is a safe and effective treatment for patients suffering from chronic venous insufficiency. You heard it here first on the Dr. Ardis Show, people. This is Cardio Flow. I want you to know butcher's broom is in this product, and I had to put it in there several years ago when we created it. You see it highlighted right there on the screen. Butcher's broom extract called rhizome at 100 milligrams. That's what's in this per serving. Butcher's broom is just one incredible of the 13 or so ingredients in there in Cardio Flow that I put in there specifically to address almost every scenario you can think of related to cardiovascular health. I hope that Cardio Flow blesses your life. I just want you to know, It was out of stock for a long time because I'm very picky about the ingredients. It is now in stock. Go get yours today. Cardio Flow, Butcher's Broom. You've seen it for yourself. It works in animals. It works in humans. It's amazing. It's been used in countries for decades by medical doctors. All right. Scan the code here again for free access to get on our newsletter. We actually have a monthly newsletter now if you want to get notified of when that's ready. And we have our weekly podcast. If you want to be notified when it's ready for the general audiences, go there. If you're not an Ardis Club Experience member, go sign up at the Dr. Ardis Show if you'd like. And please don't forget our book, Moving Beyond COVID-19 Lies. I actually dive into other ingredients, other plants inside of Cardio Flow. I highlight it as a part of multiple solutions to individuals having many, many cardiovascular problems since COVID-19 was unleashed on the world. Long COVID represents many of the symptoms that are actually compiled as a list of what are called long COVID side effects. And just a week before I produced this interview about Butcher's Broom, the Cleveland Clinic just published a week ago from the time of this recording that they expect COVID-19 sufferers who ever got COVID-19 at all will have heart problems. 25% of them, a quarter of all of them who got COVID, will have heart problems for the next 3 years. From today. You don't have to suffer for the next 3 years. There are solutions. You can find them in our book at COVID-19 Lies, Restoring Health and Hope for Humanity at the Dr. Ardis Show, and then also Cardio Flow, don't forget it. This is my effort to educate you on some of the most miraculous things found in nature that even outperform or much safer and don't have those toxic side effects as the other drugs being prescribed for heart issues around the world, and particularly in America. No country prescribes more drugs than America. This is why I'm so excited to present to you those things found in nature that science has actually confirmed outperform the inflammation and the blood flow issues that people have in the millions in America. May Cardio Flow and Butcher's Broom be a lifesaver and a life improver for you. Look forward to hearing from you. Please share with us if you're using these products and you're seeing benefits in your lives or the loved ones around you. As you watch their swelling go down in their legs, their varicose veins and spider veins disappear, I hope you'll tell us about those miraculous stories. Take pictures, send them to us. We'd love to see it. We want to celebrate with you the wins. And then we'll celebrate with you, maybe even have you come on and join us on the podcast to talk about your amazing experience 12 weeks after you started Cardio Flow. God bless you all. Have a great day. We'll see you next week. I'm Dr. Ardis.